Now, talk about a very important aspect, okay, that is very important in radiography, and this is trying to give reasons why it is very important for you to give the radiologist enough information when you are requesting for an imaging for a particular patient. So you as a bedside doctor now, is it important for you to explain to the radiologist in detail what happened, or will you just send the patient for imaging and expect the radiologist to do magic? I don't know if you understand. So let's look at it, if it is important or not. Okay, so when you are requesting imaging studies, it is very important for you to send clinical information. Okay, so most bedside doctors, they have this drama of, if they are sending something to the lab, maybe chemical pathology lab, anatomical pathology lab, microbiology lab, hematology lab, they will not really explain much. They feel like if they explain much, they are helping the other person do their work. Or if there's a radiologist, they feel like they are easing up the work of the radiologist. So it's dramas you see in hospitals, you know. But why is it very important for you to actually what? Fill up this request form properly and provide very adequate information? It's important because it tapers down the radiologist for them to keep their suspicion on something more, and it helps them to even give you back more detail, avoids ambiguity, okay, so helps to distinguish between things, improves accuracy, so it also guides technique. Okay, so it will even help the radiologist to now know, am I going to use CT scan or MRI scan or X-rays? Which contrast agent am I going to use? So you just send it to the patient, you just send it to the radiologist, and sometimes it's the patient that even suffers, because the radiologist might end up doing different things that are not relevant to the patient just to give you information. Okay, but you sending more information is not like you are helping the radiologist do their work, but you are just making them do their work better for your own good. You know, so this is a radiology request form. You can pause to observe it. You know, so key information that they should always provide include the age of the patient, sex of the patient, occupation. So you don't want the result for a particular patient to be sent to another patient. Cause a lot of issues in the hospital. You should specify the presenting complaint. You should state the period, that's the duration at which the issue has been disturbing the patient. Why are you providing this information? Because you don't want them to go and start clacking the patient in the radiology lab again instead of going directly to their work. And of course, maybe the patient is exhausted already. Okay, so relevant past medical history, clinical findings, laboratory results, differential diagnosis, and specific questions. Okay, so that's what we got for this, and it's important.